I'm happy to have you here today. We're going to be having an engaging conversation with Dr. Robin Berzin, looking at your health, your mouth, a root cause conversation, looking at all things health. So Robin, if you're out there, I'm going to go ahead and invite you to join our live, and we'll get started. So we'll just wait till we get our guest on here, Dr. Robin Berzin, physician from Parsley Health. So Doc, you should see an invitation pop up on your screen here. I'm inviting your Robin Berzin MD account, and we can rock and roll. Gotta love technology. Great when it works. All right, it says unable to join. We'll see if we can get this technical glitch evaluated here. Got my team of one here to troubleshoot and figure these things out. All right. You're invited, Doc. Just click accept. I'm inviting your personal account. Well, anyway, we're going to be having an engaging conversation here, really looking at, oh, hey, good morning, Doc. How are you?
I'm great. How are you?
Hey, wonderful. So again, we're just excited to have you today, everybody. Dr. Robin Berzin, co-founder of Parsley Health in New York City here. And we're going to be talking about health, the root causes, the mouth, the systemic system, and all things interrelated.
Yeah, hi. It's great to be here.
Thank you, thank you, thank you for joining us here, and just to kind of give our viewers a sense as you has kind of gotten to your position and kind of your background and how you've kind of developed Parsley Health and gotten to where you are.
Definitely. Well, hi, everyone. I'm Dr. Robin Berzin. I'm an internal medicine trained physician. I trained at Columbia and Mount Sinai Hospital. I also trained in something called functional medicine, which is really just an approach where we get to the root cause of disease instead of band-aiding the problem. Your heart disease, your hormone imbalance, your fertility issue, your gut health, all of these things have root causes that can be treated when we look at the body holistically. And so that's what I do. And I started a company 9 years ago called Parsley Health to make this kind of medicine available to everyone. And so we're available online nationally. You can work with our amazing team of doctors virtually. You can come see us in person in New York City or Los Angeles if you prefer that. And we work with lots and lots of people on all aspects of health optimization, longevity, and then of course we treat a lot of symptoms and diseases as well.
I love that. That's really a wonderful philosophy. And, it wasn't too long ago where that kind of approach to care wasn't so mainstream. I remember going to my physician as a younger man, and a lot of those conversations and topics weren't really discussed. And, thank God we have a new approach and a new avenue here to help folks.
Yeah, it's really crazy because when I started Parsley Health back in 2016, not a lot of people had heard of functional medicine or longevity. These were sort of edge topics, right? And the idea that you would do more proactive lab testing to figure out what's going on before you get so sick that you need a medication or a hospital was considered crazy or new. And now, in the past couple years, it's really blown up. And I think more and more people are saying, I really care about all aspects of my health. I understand that I live in a sort of a societal experience that is not set up for me to be my healthiest. And so they're taking matters into their own hands and seeking out doctors like ours at Parsley who are trained in functional medicine and longevity, who are going to spend more time with them, and who are going to really look at all aspects of their health to drive better outcomes.
I love it. And even in my practice here in South Florida, I try and take a holistic approach to treating dental disease and oral health as well. And a lot of my patients, they kind of get surprised when I started asking them questions about their nutrition and kind of how they're fueling their body. And they're like, "Oh, doc, just fix the tooth. I mean, don't worry about that stuff." And it's like, no, it's all interrelated here. And but tell us, why should dentists and physicians be having more conversations together? Is there an interplay where we can help our patients out more?
Definitely. The mouth is really a mirror or a window into the health of the body. And so if you have bleeding gums, gum disease, lots of cavities, bad breath, a coating on your tongue, these are indications that you have other issues going on. And these can be early indications that you have systemic or system-wide inflammation. It could be an indication of poor metabolic health. It could be an indication of poor gut health or an imbalance in the good and bad bacteria in the gut, even chronic low grade GI infections like parasites or yeast overgrowth. And so, the mouth kind of gets forgotten in where I trained like conventional medicine. I trained to be an internal medicine doctor, but like the mouth is the dentist problem. But the mouth is the beginning of digestion, and your gut starts at your mouth and your nose and is one long tube all the way down to your bum. And so understanding how it's all connected really begins in understanding oral health, I think.
Yeah, you bring up a lot of good points there. And I was just looking at a study previously where, there are several routes where bacteria can get into your whole systemic system from the mouth, whether it's from the bloodstream or enterally from swallowing bacteria here. And there's been research suggesting that P. gingivalis involved in gum disease, may help disrupt the gastrointestinal lining, leading to irritable bowel syndrome and other conditions of that sort. So it is really an interesting interplay between the mouth is connected to the rest of the body, like you said here.
Yeah.
So I think dentists are really on the front lines too of helping to intervene because a lot of folks, I mean, they usually see us twice a year, so we have more room to intervene because
Totally.
they may only see their physician once a year. So I really talk to my other dental colleagues like, this stuff is so important to continue to intervene and be on the front lines of health.
Yes, I totally agree.
Are there opportunities where I know you focus on systemic health, but do you do any kind of like oral health screenings or discuss oral health with your patients? Is that part of your protocol?
Yeah, absolutely. And when we're doing our intake at Parsley, where it's really a functional medicine intake, so it looks at you in a very different way than a regular doctor. We're asking questions like, what are you eating? How are you moving? How are you managing stress? Are you sitting all day? Are you staring at a screen all day, right? What are the things in your lifestyle? How are your relationships? So we ask these questions. Do you have meaning and purpose in your life? And people always say like, we go back in time to your childhood. People always say, I had to ask my mom some of these questions. It's a really sort of deep dive. And then in our initial visit, we kind of go through all of that with you in an hour-long visit online for most people, in person for those who are in New York or LA. And we really kind of deep dive. And even if we're virtual with you, we do a physical exam and we ask about like, are you having problems with your teeth or mouth? And this might be a flag for us that you have systemic issues. Conversely, we can help people heal some of their system-wide issues, and then their oral issues actually get better.
I love that. It's a really great team approach here. And one thing that I think there's a lot of overlap between our two aspects of medicine is nutrition. And I constantly talk to patients about the relationship they have with their nutrition because so much of oral health breakdown goes back to fermentable carbohydrates, elevating your sugars, and trying to watch the level of pH in your mouth. And it's interesting. There was a fellow back in the 1930s, Weston Price, wrote a book on nutrition and health breakdown. And we had the answers back then. It's kind of like we come full circle. I mean, he took a year off of his practice to travel the world and studied these indigenous populations and noticed that people that didn't have contact with the quote unquote Western diet, where they were eating more traditional type foods and rich in fibers and minimally processed foods, really didn't have much oral health breakdown. But as soon as you have these civilizations near the water, near these trading ports where the Western diets were introduced and refined carbohydrates and sugar started entering the diet, you see a lot of this breakdown. So it's just funny how we had the answers 100 years ago, and sometimes it takes time for us to rediscover these concepts.
I think our diet has changed so dramatically, particularly over the last 50 years. The CDC report last week just said that 55% of all Americans' diet is ultra processed foods. These are foods that are often pre-digested, high in sugar, high in fatty acids that are not great for our gut and our cardiovascular system, low in protein, low in fiber, low in the kinds of phytonutrients that are critical for our cells. So we're living on a diet that is feeding inflammation in our body. And it's also feeding an imbalance in the good and bad bacteria in our gut. And as we said earlier, the microbiome, like the human body is an ecosystem. We have trillions of bacteria living in our gut, but also in our mouth and on our skin, right? The microbiome is a big portion of it is in the gut, about 6 pounds of bacteria and viruses and fungi, but also living everywhere else. It's not just in the intestinal tract, right? And so the foods we eat, I always tell people who lives and who dies in your gut is a matter of what you're putting in your mouth every day. And then those bacteria in turn are regulating our immune system, our gut barrier integrity, and feeding back up into our oral health. And so it is all connected. And I think when we're kids and stuff, I just took my kid to the orthodontist this week and they noticed he might have the beginning of the cavity on one of his back molars. We're going to the regular dentist next week. As I like, and of course, in my house, we're eating like as healthy as possible, very limited processed foods. But, when you see this developing at such young ages in an otherwise healthy kid, I think we sometimes think, oh, it's just about like brushing your teeth. But it's not just about brushing your teeth. It's about what you're eating every day that's going to feed good or bad bacteria and create a climate for a healthy mouth or not.
Yeah, you make a good point. I mean, a lot of it goes back to nutrition here. And really, as you increase fermentable carbohydrates and sugars, and a lot of my patients are surprised too. They think just dessert, sugary type foods, but I really got to tell them everything you eat pretty much breaks down into fat, protein, or some kind of glucose molecule. So even if it's not a quote unquote dessert type food,
Yeah.
pastas, crackers, people that don't suspect of like the carcinogenicity of these foods is kind of off the charts of some of these crackers and
Yep.
letting them know that that has a lot to do with it too. And when the pH dips in the mouth, you create the environment for demineralization. The cavity
Mhm.
process, it can demineralize and then reharden to remineralize, and that's where
Yep.
we try and intervene at Risewell. But when you have these conversations with your patients, are they surprised by this, or is the information out there and they're just kind of resistant to changing? It's like, oh, doc, I kind of knew that, but it's hard to make these changes, or is it kind of new and you're blowing their minds when you have these conversations with them?
I think it's the information's out there more and more, but there's like this high level information, and then people don't necessarily know how to translate that into their everyday.
Sure.
And so I think a lot of people get stuck with, listening to a live like this, or reading a blog post, or hearing about it in a news article. And people are starting to connect the dots. I mean, I think people really get it, but making those changes every day, what we find works is actually work with a doctor. Don't try to do this on your own. Work with one of our functional nutritionists, right? Learn which foods in your diet might be sneaking in there that you think are healthy or but are not. I just did a newsletter this past week on the protein bar and health bar industry and how a lot of these bars that we're eating that are marketed to us as healthy are low in fiber, high in sugar, full of preservatives and chemicals, not organic, or have really terrible sources of protein in them and just aren't actually good for us and are effectively franken foods and ultra processed foods in disguise. And so
Yeah.
I think that breaking that down and working with someone and figuring out, okay, what does this mean in my life and what I'm eating every day, and recognizing that, like, listen, I'm a busy mom. I have 3 kids under 8. Like, I'm running a company, I'm a doctor, like, life is crazy. You can't
Yeah.
always like make some elaborate meal for every single thing, but you can start to learn to make choices that fuel better health for you and your family if you know how to translate the information, carbs, sugar, glucose, right, into what am I eating and feeding my family today. And I find people just do better when they have a little bit of guidance around that.
Yeah, you bring up a lot of great points there, and thank you for that for your advice on that. And looking at also at the chemical load and toxins in the environment and in our beauty products and foods, what are some of the most common, I guess, unfortunate ingredients or toxins in our personal care products? Do you find there are some common themes and some of the unfortunate ingredients in the common personal care space?
Yes, and I've been on this train for like 10 years, since before it was cool, getting all of our patients to go to the Environmental Working Group's website and use their tools to understand their app that they have now to understand the burden of toxins in your personal care products, right? It's not that maybe a teeny little bit of this one thing once is going to hurt you, but the reality is it's not a teeny little bit once. It's average woman before she leaves her house uses 12 personal care products, toothpaste being one of them, but across shampoos and makeups and moisturizers and lotions and skincare and all these different things. And most of them are loaded with everything from phthalates and parabens, which are hormone disruptors, artificial fragrances, which are also usually hormone disruptors, quote, natural flavors, which is a grab bag of toxins that companies are allowed to hide things behind,
Yeah.
heavy metals like mercury and lead. I did a piece on this a few months ago on the report came out that the Crests of the world and all the major toothpaste brands all have heavy metals in them. You know, we freak out if there's lead in the paint in your walls, but if there's like lead in the toothpaste that you're
Yeah.
giving to a kid, somehow that's okay. And
Yeah.
I know that there's this current big focus on, food dyes and chemicals in our food. And some people are like, this isn't our biggest problem. This is overblown. But I'm like, listen, when this is in everywhere in all of our products that we're eating and using and cleaning our house with and putting on our skin, the skin is an organ of digestion. What you put on it goes into your bloodstream. And so, what you put in your mouth is a mucosal surface that is highly vascular and highly absorptive. So, everything, even that mouthwash that you swish your mouthwash and spit out that you're like, I don't swallow, this is being absorbed systemically. And when you add all of these things up, it's not just the conscious moms and the folks who are, have been sounding the alarm on this for 10 years. It's Mass General Hospital and Harvard and Mount Sinai Hospital's programs and Johns Hopkins who have major research studies about how all of these things are impacting our fertility and impacting our hormones and impacting our heart health. A recent study just came out that if you put air filters in your house, if you're someone who lives near a freeway or lives in a polluted environment, that you cut your risk of heart disease.
That's
So
unbelievable.
what's around us and in our products really matters. And, again, at Parsley, we've been helping our patients and those who work with us understand this and test for this for a long time.
Yeah, you make a lot of good points there. I just want to piggyback off of some of those ideas in the personal care space. Really to illustrate the example to the listeners here, looking at some of the things you might find in your oral care products, like sodium lauryl sulfate. It's a surfactant. It's a detergent. Yes, you put it in shampoo, so it creates the suds and bubbles to make it look effervescent, like it's working more. But like you said, the mouth, oral mucosa, highly absorbent layer of skin. You really don't need SLS in your mouth. You don't, it's an unnecessary detergent. It interferes with fibroblasts. Fibroblasts are critically important in wound healing. So if you just had an extraction or a dental implant, it's going to impair your body's ability to heal. Also looking at alcohols, we always try and avoid alcohols too, because when you're blasting away all the healthy bacteria in your mouth, there's research to suggest that on the back of the tongue, there are these nitrate reducing bacteria that help to produce nitric oxide. Nitric oxide, super important in vascular health and blood flow to all areas of the body here. So all these little decisions you make on a daily basis impact many downstream effects, to just try and illustrate that for the folks at home here.
Yeah, and so being really aware of what's in your products, I think it's so good. And being aware that, you brought up the bubbles, right? We all grew up and got schooled that when you have all these bubbles on your teeth, like in the cartoons, that means they're getting cleaner.
Yeah.
And that's not true. That's just marketing. And all these toothpaste, right, with those little like micro beads and stuff, those are just plastic bombs. Those are literally bombs of microplastic.
Kids
And
love them.
kids love them because they're fun and they're cute and
Yeah,
they're
yeah.
sparkly. And, I think this generation, I don't know how old you are. I'm in my early 40s. I have 3 kids. I am an 80s baby, right? Like solid millennial over here. And I think like Gen X, millennial, Gen Z, like we kind of grew up schooled that these things were normal and this is like how you should brush your teeth or how you should use products. And I think everybody's kind of waking up that this is not it. And this stuff is making us sick. And yes, not having the bubbles is like less fun, but those bubbles are making you sick and you don't need them.
I hear you. Yeah, I'm an early 80s baby myself here, and definitely people are waking up to a new way of doing things and things that we just didn't question back in the day. But thank God we've kind of woken up to some of those things.
Yep.
So I want to get your feedback on chronic constant low-grade inflammation and what downstream effects that may have on the body. 'Cause I think there's a good interplay between oral health, systemic health, and how inflammation might be contributing to certain downstream effects.
Yeah. So inflammation, for everyone who's listening, is a word that I think gets thrown around a lot. And a lot of people are like, have you heard of inflammation? Yes. Could you explain it in a sentence? Fewer hands go up. And so inflammation is a natural immune process. If you scrape your knee, your immune system will come into that area, and the swelling and redness that you get and the pus and the scab that forms over, that inflammatory process is a positive healing response. That's awesome. You want that. However, when your immune system is kind of on in a low grade way all the time because it's constantly getting triggered, it's kind of like you always have soldiers out patrolling the streets doing damage as opposed to going home when the war is over. And
Sure.
so there's a lot of collateral damage from that when your immune system is turned on all the time. When your immune system is turned on all the time in response to chemicals in your diet that you're exposed to, Roundup or glyphosate is one of them. In response to foods you're sensitive to or allergic to, gluten for some people, dairy for some people. In response to alcohol, ibuprofen, um, other chemicals and preservatives in our diet that disrupt our microbiome, that impair the gut lining of our guts, that are keeping our immune systems intact. 70% of your immune system is in your gut, right behind a gut lining that's one cell layer thick. And again, when that immune system is only seeing what it's supposed to see and it's doing what it's supposed to do and it's turning on and turning off and turning on and turning off, great. But when it's seeing all this stuff all the time, it's always on. And when that happens, you get not only leaky gut, but leaky capillaries. So you get a cardiovascular or heart health system, all your veins and your arteries that get inflamed. And so bleeding gums, for example, can be a sign that you've got systemic inflammation. And so, again, when our immune system's turned on in this low grade way all the time, what happens? We are not as good at managing our blood sugar, and over time we develop diabetes. We gain weight. We're not as good at fighting off infections. We get colds and flus, but we're also not as good at fighting off cancer cells, because one of our immune system's job is to float around our body, and every time it sees a cancer cell, to blow it up. And when it's busy being inflamed all the time, it doesn't do as good a job at that. It starts to impact our skin. And so you start to see breakouts and eczema and psoriasis and acne, right? So our body is this ecosystem, and our immune system, when it's basically tweaked all the time by all of these different inputs, stress is another one that will do it. Chronic stress, not stress like running from a lion, but stress from running from your email all day, every day.
Yeah.
These things start to really impact and create this chronic inflammation. And that's something that you can sometimes see in the mouth.
Yeah, you touched on a lot of good points there. One thing I want to highlight too is a comment you made about bleedy or gums that bleed easily. So looking at
Mhm.
gingivitis, that's a reversible transient infection of the gums here. Periodontitis is irreversible bone loss when that has progressed untreated. The body, that constant low-grade inflammation, the body reacts by receding the soft tissue and bone away irreversibly. So it's unfortunate that it's painless. I think if it caused pain, people would actually go and get it treated sooner instead of waiting 20 years and then finding out that, their teeth are
Right.
falling out, unfortunately here. But, there was an interesting study looking at the bidirectional relationship and influence of periodontal disease on diabetes. So if you have uncontrolled diabetes, it potentially could exacerbate your poor gum situation. And if you have uncontrolled periodontitis, it can unfortunately negatively impact your A1C and your risk for further diabetes progression. So it's just kind of interesting the interplay between oral health, systemic health, keeps coming back together here. I'm curious also, looking at nutrition, what advice do you have for families looking to improve nutrition? I know there's some obvious things like, trying to cut sugars and fermentable carbohydrates, but how do you have a conversation with your patients about nutrition and what actionable items they can implement?
This is my favorite conversation to have, especially with parents like me who are trying to make good choices every day to feed our families. And the thing I recommend is just eating as many whole foods and whole fruits and vegetables as you possibly can. And, I am not like the world's biggest cook, but I make simple recipes all the time that just include vegetables, a healthy source of protein, and a whole carbohydrate. So, like a quinoa or a wild rice, or lentils, right? And I just make simple meals for my kids. We make extra and we put the leftovers in their lunch every day. So dinner is also lunch the next day with some other, cut up vegetables and crudité and other things around it. And we kind of like make it easy for ourselves that way, but we don't have our kids get lunch at school. We don't do prepackaged lunches. We try to just double up in that way.
Yeah.
And the more you can reduce the amount of refined sugar and carbohydrates in your kids' diet and get them on real whole foods. Our society has taught us that kids need kid food, and that kid food is like, by definition, chicken fingers, pizza, and french fries. Like, who decided that? Who decided that that is
Big
like an
food.
acceptable way to feed a growing body with has a growing and impressionable nervous system and a growing and impressionable microbiome? These kids menus, I'm like, my food is my kid food. Get your kids used to eating normal food. Grown up food is kid food. There's no such thing. And really just try to eat as many real whole foods as possible. And then when you are on the go, look for organic, look for macros, meaning the very low in sugar. Nothing you feed yourself or your family should have more than 10 grams of sugar in it. And that's just a rule. And so if you look at a bar or a snack food or, a drink, even things that are purported to be healthy, a lot of times you'll see things that have more than the 10 gram of total sugars. I don't care if it's added sugars or not, doesn't matter. Total sugars, it's got more than 10 grams, it's got to go.
Yeah, you make a good point there, looking at the insidious nature of how big food is able to pack pretty much everything with just hidden sugars. When you look at just like salad dressings and condiments and just sauces, there's so much just added sugar in everything. It really is mind-boggling. And look,
And
I'm a cap.
I also want to just mention seed oils too, right? Because there's been so much confusion about seed oils. So like people are like, well, what's the difference between this like handful of sunflower seeds that I think are like healthy and then this sunflower oil that I'm told like is killing me?
Yeah, tell me.
um, and so the two there's two differences. One, the seed oils like degrade super quickly, and so over time, if they're just in stuff in packaged and processed foods and salad dressings and all these things, they like all oils, they get oxidized, and so they're not as good for you. But seed oils on their own, if they're from a good source, organic, if they're cold pressed, if they're fresh enough, are not necessarily bad for you. What's bad for you is that we get so many of them. You
Okay.
really don't want more of it, more than a 4-to-1 ratio of your omega-6 to your omega-3. But listen to what I just said. We should be eating more omega-6 fats, that kinds of fats that are predominant in seed oils, than omega-3s. It's not a 1-to-1, it's a 4-to-1.
Okay.
Problem is the average American's getting like 25-to-1, 30-to-1. And the reason we're getting so many seed oils, so many omega-6 fats, is that we're eating lots of packaged and processed foods, even salad bars and a lot of restaurants. Seed oils are a lot cheaper than like an olive oil. So they
Sure.
use them, and they don't use the healthier fats. And so the problem is not that you can never, ever, ever have like some organic sunflower oil in something. The problem is if you're eating a lot of packaged and processed foods, you're getting way too much of that stuff. And in addition to that, the average American is not eating high quality seafood. They're not eating high quality olive oil. They're not getting enough of those omega-3 fats. And so we're way out of balance. If we bring that back into balance, we're okay. And so I think seed oils have been a little bit like overly demonized as sort of toxic no matter what.
Yeah.
That's not true. And what's the fix? Get rid of packaged and processed foods. I'm going to sound like a broken record. Make as much of your food as you can. Keep it simple for the kids, which is what I do. I use ChatGPT and I tell ChatGPT what ingredients I have at home and it generates a recipe for me that's kid friendly, meaning just simple, but still with some spices, still with some good flavor, and make that as much as you can.
Sound advice. And just to summarize, would you kind of put your hierarchy of oils, maybe like olive, avocado, coconut, and then like seed oils, or how would you put your hierarchy of oils if you had to list them out?
Yeah, I mean, it depends on what I'm doing, right? I try
Sure.
my hierarchy, I take a tablespoon of olive oil every day straight because the research shows that it reduces dementia risk and increases cognitive function long
Wow.
term.
Okay.
I really love a few brands. I love Costa Rica is one of my favorite brands. There's a lot of olive oils that are cut with other oils, so just be careful that it's 100% olive oil. I put olive oil as like the first thing that goes in all my salads and everything else and on my vegetables. So I would say olive oil most of the time. If you're cooking in high heat, olive oil will start to degrade and oxidize because it's not really meant to be cooked in very high heat.
Okay.
And that's when you need to look to like say your coconut oils or your other types of oils or your butters or your, tallow, your animal fats. And that can be really helpful for like your high heat cooking. And then again, sometimes you might be using also for higher heat cooking for specific recipes, some of your organic cold pressed sunflower oil, seed oil, for example, or some of these seed oils. And you might lose them in cooking a little bit. But again, where you're getting most of your seed oils is not in cooking. Where you're getting your seed oils is in packaged and processed foods and restaurant foods.
No, thank you for that recap.
Yeah.
One of the things I talk to my patients a lot about, you already mentioned, was the processed foods and the amount of sugar that are in things, and just how it's a direct relationship to the level of decay and oral breakdown you have in your mouth. And hey, look, I'm a capitalist. I'm all for free choice, but I really think sugar should have like a warning label on it because the way it lights up your brain and the addictive potential. I mean, I feel like it could be a class action lawsuit waiting to happen without warning labels. But it is such incredible how much added unnecessary sugar is in everything. And big food has found ways to just get us hooked onto all these delicious treats they make. And I'm all for free choice, but people just need to understand the downstream consequences and negative sequelae that's happening inside them.
Yeah.
Uh, looking again, but put nutrition aside, what other advice or recommendations do you have for families with young children, really setting them up for a lifetime of not really needing big medical industrial complex and just how to live a healthy lifestyle with minimal surgical or health interventions? What advice do you have for that?
Parents and families, there's so much we can't control, right? We can't control what they feed in the schools right now, although good for Eat Real and some of the other folks out there for trying to change that. We can't control always the pollution that we're exposed to, or a lot of the things that happen in our health that are outside our control. But there's a lot that's in our control, and the foods that we eat and put in our bodies every day is number one. And I recognize that a lot of folks live in food deserts. It's hard to get things, but there's online grocers these days that have good deals from Costco to Thrive Market and everything in between, where you can get organic produce, you can get high quality like bulk ingredients, whole grains, beans and lentils, good quality protein, and stuff it in your freezer. And really just try to make your food as much as possible. And I consider it a life skill of teaching our children how to cook and cooking with our children, just like simple meals. From there, I think exercise, right? Exercise is nature's wonder drug. There actually is no
Absolutely.
longevity drug today that beats movement. Nothing. And movement is not only how we prevent disease, it's how we create strength, it's how we keep our digestion moving. The body's designed to process our emotions through movement. So if your kid or you are sitting all day and not moving, and then you're wondering why you're anxious and depressed and stressed and can't sleep, well, guess
Yeah.
why? The body was not designed to sit and not move all day, your kids or yourself. And so getting your kids, in sports, walking. I live in New York City. Like we're not, it's not like as much of I grew up in Baltimore, Maryland. So it was much more of like lacrosse and field hockey and soccer and all these things. I'll admit to you, it's a little bit harder here in New York, but our kids play soccer in the local playground. And the great thing about New York City is we walk everywhere. My kids walk so much. When I went up a state for a week to the countryside, all of a sudden we were driving everywhere and our step count went like to the floor. So
Wow. All right.
wherever you can get it, right? It's if
Yeah.
you're a big sports culture, awesome. If you're walking in a city all the time, like we are, great. But really instill that love of moving your body to children. I think honestly, those two things are the yay, Baltimore, someone. Yeah, I'm from downtown Baltimore City, everyone.
Inner
Grew up
Harbor.
downtown. Inner Harbor. I grew not all the way
Let's
quite there, but
go.
I grew up in Baltimore City. My family now lives on the Inner Harbor. Big lacrosse culture. I sucked at sports, but I was forced to play them anyway, and I look back and I look back and I'm glad about
Yeah,
that.
you got exposure.
Yeah, got the exposure. Was forced to do it, but I think it's just so important. And then the third thing is, where you can. And I understand we all have to pick our spots, and becoming obsessed and maniacal about your products doesn't help. But I use Risewell toothpaste. I use it for my kids. I don't use shampoo or soap on my children. So I've
Okay.
actually never, I think maybe once or twice if they were like really dirty for some reason, or their hair was just gross. But
Yeah.
my three children are 8, 5, and almost 4, and they've probably had actual shampoo in their hair or soap on their bodies like less than 10 times in their life.
Okay.
A bath that cleans them off with just water. I put a little bit of like body oil or coconut oil in the water of the bath just to like moisturize their skin. But
Yeah.
they're not dirty. You're not scrubbing out a stain. And all of
Yeah.
these
Yeah.
soaps and perfumes and bubbles and things, you don't need it. And so I just saved a bunch of money because I've spent, 8 years as a mom not buying shampoos and bubble baths and things for my kids. I think there's these little decisions of, what are the products you're giving them, and then I just again I we it's a pain, man, but like we have it down to a system. We make their lunch. And I
Yeah.
think those are the things that you can do to really alter the trajectory of your children's health that are in your control, because I
Sure.
recognize not everything is.
No, again, just great wealth of advice there, and I think the viewers really appreciate that. Do you have
Yes,
concerns
by the way,
about?
whoever's asking on the do they sweat? Yes, my kids do sweat. But if you wash your child thoroughly with just water, all that sweat washes off. They're not dirty. They don't smell. I promise you.
Yeah,
Try it and let me know.
all those unnecessary chemicals just strip the natural microbiome on your
Yeah,
skin
and
and natural
those
flora.
deplete your microbiome. Like we strip our
Get
microbiomes
rashes.
with all of these products that we put on. Like, so I just don't put products on the kids.
No, I hear you. Now, do you have concerns about the effect of screen time and social media on young children? We're talking about young people and their ability to thrive and have a well, meaningful life. Does that enter into the equation of maybe mental health, or just competes with their time for physical exercise? Or how do you balance those forces?
Yeah, it's absolutely critical. I mean, all of the research on social media at least shows that it's toxic to developing brains, and that it's toxic to emotional health of, tweens and teenagers. And to wait to allow your child to have any access to social media till 16. And we don't do iPads in our house. We don't do screens during the week. We really limit screen time. I mean, I grew up in the 80s and 90s, and my family didn't have cable, so we had like 4 channels. I mean, until I was 18 and I left for college, we had like
Yeah.
4 channels. All you could watch was like PBS and the news. I mean, it was so boring.
You could
And
go outside and
so,
play.
and I survived. And I grew up in
Yeah.
this, about, like I said to everyone, I grew up in downtown Baltimore City. I didn't grow up in the countryside, a big farm or something. I like was in the city, but I just didn't have those things. And so I'm like, well, my kids don't need them either. I also get that it's really, really, really hard. I mean, my 8-year-old son demands video games on a daily basis. And our answer is no.
Yeah, the torture.
And it's actual torture. It grates on the parental brain. I get it. But I'm just calling to all parents to help each other and come together to not allow our children to be totally co-opted by this stuff. And I listen, weekend evenings, we do cartoons and we do shows. We're careful about what they're exposed to. It's not perfect. We're not a zero screen house. I definitely don't want to say that we are. I mean, weekend evenings, they earn their showtime. But it's not perfect, but it's highly limited, and all of the data shows that that is optimal. And like, it's not about guilt tripping anyone, because I get busyness, childcare, school's out, summer. I mean, you want to like hit your head against the wall sometimes, but you, the answer is not to stick them in an iPad for hours and hours a day. It's just not.
No, I get it. I don't have kids yet, but appreciate the advice here, and I'm sure the
Yeah.
listeners are
Look
thankful as
out.
well. And yeah,
Look out.
yeah,
I'll send
someday,
mine
someday.
your way to beg you for your iPad.
I got 5 nephews from my 3 sisters, so they
Oh,
they
there you
give me
go.
plenty of exposure. Yeah. Looking at the interplay between hormones and stress and just overall systemic health, do you see an interplay of just health breakdown when you have your hormonal imbalances or different things you're going through in life, like maybe pregnancy or different things that affect the hormones, and how that can potentially negatively affect health and how you deal with that with your clients?
Yeah, we do in-depth hormone testing on all of our patients. It's part of we just launched actually our Parsley Longevity Labs. They're available nationwide, and it's over 100 tests that every woman needs to stay healthy every year. We do testing initially and then at the 6-month mark so you can track your results. And whether you're a patient at Parsley working with our doctors or you're doing our new longevity labs, we're testing this stuff and we're seeing where is your thyroid, where is your progesterone, your estrogen, your testosterone, understanding where your levels are. Fasting insulin is insulin, everyone, is a hormone. We want to look at these things and then intervene. And it's not just about getting your data and getting your numbers. I know everyone's kind of a data freak now, but that's great. People bring like other people's tests to us at Parsley all the time and say, what do I do with this information? And so
Yeah.
with our lab testing, whether you're a patient or you're working on through our labs product, we actually tell you what it means and what to do with this information. And with hormones, there's so much that you can do. Um, Blood sugar is a huge impact for hormone health, male and female. When your blood sugar goes up, your cortisol, your insulin goes up. When your insulin goes up, your testosterone goes up. And when testosterone gets developed, it breaks down into estrogens. And so when high blood sugar is high all the time, you get this cycle into a derangement of your hormones that can impact your fertility, make your menopause or perimenopause symptoms worse. So people talk about their hormones a lot. I always explain to them in our patients in our practice and on all the content we do at Parsley. Sometimes what's happening with your hormones is actually starting over here with your blood sugar, or starting with your microbiome and how you're recirculating your estrogens, or starting with your gut health. If you're not pooping every day, you're going to recirculate your estrogens a lot, and you're going to have a lot of PMS and symptoms of high estrogen levels, or sort of estrogen metabolites, and not necessarily in a way that's going to give you a disease, but in a way that you're going to feel functionally, and we can do a lot about that.
Yeah, a lot of good points there. One thing that how it directly relates to the oral health here is that women going through menopause and looking at hormonal decline and estrogen declines can lead to dry mouth. Saliva is very protective against decay. So when you have a declining level of saliva, unfortunately, you're at a higher risk for what they call root caries or root decay. And so
Mhm.
just talking to your physicians about that. Also, do you talk to women about hormone replacement? Is that on the radar? Is that something that occurs, or how
Absolutely.
does
We
that interplay?
we do HRT all day at Parsley.
Okay.
So all of our providers are trained in hormone replacement therapy, in safe, effective hormone replacement therapy, bioidentical hormone replacement therapy, conventional hormone replacement therapy. We do it all, and we base it on testing and your symptoms and what's right for you. The 2002 study really was misinterpreted, and Women's Health Initiative study that said that hormone replacement therapy was causing cancer and heart disease and brain health issues. And when we look back, actually, hormone replacement is really preventive and supportive for these things. And so that led to a generation of folks not having, hormone therapy. And luckily, we're turning that around. It's not appropriate yet for everybody, but we do a lot of treatment there. And then you also mentioned dry mouth. If anyone is experiencing dry mouth in the morning, it is so important to pay attention to. Not only is that potentially a sign of, hormonal changes and something that's more common in menopause, but it's a sign of sleep apnea. And if you're mouth
Yes.
breathing, it could be because of chronic nasal congestion, alcohol overuse, inflammation, and then you're not oxygenating your brain at night as well. And it's something that we also screen for at Parsley.
All good points. You're speaking my language. When people are designed to be breathing through their nose, nasal breathing warms and humidifies the air. Again, also when young children are developing, it's important that their mouths stay closed. You breathe through the nose because when your mouth is closed, your tongue is high up in the palate. It kind of
Mm-hmm.
helps to gently expand the palate, trying to minimize the need for orthodontic intervention. So nasal breathing is the way to go, and you can encourage your kids to do that. So Dr. Robin, I want to be mindful of your time here. Just a couple more questions here. What is your personal routine? Are you exercising in the morning, afternoon? What specific foods are you eating? How do you stay healthy and optimized?
My routine is as follows. In the morning, I have my double espresso. Can't live without it. I make it at home myself, so I save the money on a fancy coffee shop. I do a 15-minute meditation. It really sets my day. If I'm just following my breath or doing a visualization work, that meditation is really critical for my morning routine. From there, I'm really kind of going off into my day. For moms, I feel like this idea that you're going to do all this exercise and all this crazy stuff in the morning, God help you. Like my morning is getting my kids to school and getting
Yeah.
to work. I tend to do some of these other things in the evening. So I'll exercise at home in the evening, whether it's an online HIIT class, yoga class. I have a weight set in the basement. I also have an at-home sauna, which has been shown to be not only detoxifying, but good for cardiovascular health. So those are types of things I usually do in the evenings, either right when I get home before kind of dinner time or after the kids are in bed. Those are my times. I wish I could exercise during the day, but let's just face it, it's not happening. And then my routine is to take my supplements at night. So people always ask me, when do you take your supplements? What supplements do you take? Morning, I'm doing a lot of intermittent fasting. I'm typically breaking my fast around 11 a.m. And so I don't like taking supplements on an empty stomach because they make me feel a little nauseous. So just because, not because the supplements themselves, it's just because you put any supplements on an empty stomach, you might feel a little nauseous. So
Yeah, been
what
there.
I do is take them during the day or take them at night. So I brush my teeth with my Risewell toothpaste. And then I'm taking my supplements in the evening because that's when I will remember to take them. They're right next to my toothbrush. People always ask what's the best time to take supplements. My answer is when you'll actually take them and not forget. Because that is for most people the biggest issue is not actually taking them, not optimizing when they take them morning, noon, or night.
That's great. We're going to switch over now to some Q&A from our viewers here and just kind of get their feedback here. We have a question looking at, again, just to recap the oils here. Someone is asking about best oils to cook with. Is avocado okay? And what's best for high heat, high temperatures? Just to recap.
Yeah, so avocado oil, coconut oil, again, organic sunflower oil, olive oil. Olive oil is my go-to for everything unless I'm in high heat cooking. And then you want to have an oil like, especially a coconut oil or even like a beef tallow or something that's going to survive higher heat cooking.
Sounds great. Thank you. Also, I feel this next question comes in from a listener. I feel like my oral health declines during pregnancy. Is that normal? And what different things should I be doing when pregnant to help oral health?
I'd be curious what specifically this person means about oral health during pregnancy, like what specifically declines. We know that in pregnancy, changes in our hormones and changes in our microbiome can change our gut and like change our breath. The things I recommend with pregnancy, first of all, pregnancy, be really mindful of the kinds of toothpaste and products that you're using and putting in your body. Those are going to baby too. Make sure you're taking at least 2,000, ideally 5,000 units of vitamin D3, K2 every day to support bone and teeth of future baby, in addition to yourself and your own immunity. Make sure that you're eating a whole foods as organic as is possible, everyone diet. With lots of fruits and veggies, good protein levels, and whole grains, and then watch your blood sugar, right? We lose some of our blood sugar control and we're prone to things like gestational diabetes when pregnant. So now I know we get a lot of pregnant women a message, what I think is inaccurate, to sort of become a couch potato and eat like ice cream and eat whatever you want all day. Your baby only needs about 200 extra calories a day, which is not very much on top of your regular diet. Definitely not saying starve yourself, people. I'm just saying you
Okay.
don't need to eat a tub of ice cream on top of
Yeah.
your regular diet to feed your baby. Eating healthy, staying strong, staying as active as you can, these are the things that I recommend. We do so much fertility optimization, fertility care, helping women get pregnant, helping support women during pregnancy, and then, of course, postpartum and beyond at Parsley. I personally have patients I worked with when they were trying to get pregnant in their 30s, and now they're in their 40s, and we're doing hormone replacement therapy. So I'm like the whole journey. Um, you kind of want to just be mindful of all of those same things during pregnancy.
That's gonna be super rewarding work here, and also one thing to piggyback on here. We've
You're
got we've
coming
got
with me. I'm being
yeah,
invaded by my
sure thing,
3-year-old, so we might
sure
have to
thing.
wrap up.
Sure thing. Yeah. So again, how can our team help support you? How can the Risewell community support you? What are your projects for the future? And how can we help you?
No, just, stay in touch, Risewell community. We love you. We love Risewell products. I use them myself. My kids use them. My screaming 3.5-year-old who's home from school today uses them. So sorry.
All good. We're almost done.
Um, And, stay in touch with us, parsleyhealth.com, if you're looking for functional medicine care, functional lab testing. Longevity Labs just launched nationwide. So If you have not had proactive preventive testing, do not wait. Sign up, get your labs today. You can get them at any Quest across the country, and we will help you interpret them and help you make use of that information in addition to tracking it in a beautiful way.
Dr. Robin, thank you so much. Everyone go check out Parsley Health, and thank you again for all that you do for us.
Thank
Take
you so
care.
much for all you do. Bye, everyone. Have a great day. I'm going to go
Take
figure
care.
out why this little one is screaming. Okay, bye.
Bye-bye.